Hey guys, first, sorry if there's a little bit of humming noise in the background. My AC unit's being very loud, but I talk loud naturally, so hopefully that'll help. So in this video, we're going to be discussing vaping and coronavirus, what the research is telling us, and what we need to know about its risks and ways to mitigate these risks for our health and safety. COVID-19 is a virus that attacks the respiratory system. And with that comes the issue of using e-cigarettes like Juuls and packs and what that means for one's risks of getting severe symptoms. I felt the need to make this video because what quickly and publicly emerged was a battle where one side were public health and medical experts that advised against using e-cigarettes, while on the other were pro-vaping trade groups, large companies including Philip Morris, and harm reduction and tobacco quitting groups. It invited the spread of a ton of misinformation, sadly at the cost of the tens of millions of Americans who do use electronic cigarettes and vaping devices. And this escalated when the CDC reported that in mid-April, nearly 40% of COVID-19 hospitalizations were for a person ages 20 to 50, quite a few of them with underlying chronic conditions, but some were otherwise generally healthy. And that invited speculation. So a popular question became, and still is, does either tobacco cigarette or e-cigarette smoking that these young people are doing putting them at risk for more severe symptoms? And the truth is, at least 41 million Americans in 2018 use vapes at least on a semi-regular basis. So with numbers that big, there had to have been many people who smoked cigarettes or vapes and had no other conditions that ended up finding themselves on ventilators. The question is though, are those two things really related? The questions, does vaping worsen coronavirus symptoms or make us more prone to getting the virus in the first place, unfortunately cannot be answered neatly with a yes or a no. To this day, there has not been one single study directly tying e-cigarette use to coronavirus. Also, doing research on e-cigarettes is really hard. When you try to learn about health consequences, for example, you run into the question of, did past cigarette smoking damage the body before this person took e-cigs? Also, with vaping, there are so many variables, including device combustion levels, nicotine concentrations in the liquids, how long a person takes a puff for, and all of these variables can manipulate the data in these studies. No two vapes or e-cigarettes are really the same. So I wanted to look deep into what the research is saying and to see for myself what the data actually is out there that can tell us about the risks of vaping, especially with the pandemic being out there, and what that might mean for someone's health if they were to catch the virus. Using databases PubMed, Medline, and Embase, I extracted 21 systematic reviews which each synthesized the results of multiple individual studies to examine the risks that are being found with regard to vaping. Here were my biggest findings. The vast majority of research did show a connection to electronic cigarette use and some respiratory conditions, including bronchitis, asthma, and general inflammation of lung cells. And frankly, that is concerning because a large portion of the most severe cases of COVID-19 were in people with chronic lung disease or moderate to severe asthma. Now, there's a few moving parts to this. There definitely seems to be an increased risk with using flavored products. The biggest determinant in linking e-cigarette use with respiratory problems is the presence of flavoring liquid or chemicals. Quite a few studies show that flavored vapors with or without nicotine were connected to toxicities detected in subjects' lungs and cellular inflammation. Some of these reviews isolate certain chemicals that are often found in flavored vapors that seem to be the main culprits for toxicities and cancers. In one 47-article meta-analysis, only 2 of those studies showed that flavoring was not associated of any kind of inflammation or ailment of any kind. We do see in these studies that e-cigarette use, flavored or not though, can cause similar respiratory effects. Because positive associations between these respiratory ailments and non-flavored e-cigs were consistently present in these studies. Several enormous studies also linked vaping to the onset of COPD, including one 40,000 person cross-sectional study from Sweden and a 705,000 person surveillance study. Chronic lung disease is largely found in the severely ill of the COVID-19 patients. And zeroing in on flavors a little bit more, a lot of these studies isolated specific chemicals that seem to correlate the most with lung injury, especially epithelial cell inflammation. The interesting thing is that different flavors carry these chemicals in different quantities. Now, with regard to respiratory illness and vaping, we didn't talk too much about the nicotine itself because the evidence on that isn't quite as conclusive. The majority of studies that separated flavored from non-flavored e-cigarettes were mixed. In one 47-article meta-analysis, the same one as last time, 16 of them concluded respiratory toxicities were either caused by only flavor and non-nicotine, or concluded that nicotine itself did not seem to result in significant respiratory injury apart from the controls. 13 of the studies did show that nicotine and flavorings had cytotoxicities. So the risks with nicotine don't necessarily seem to relate to the respiratory ailments, at least as strongly as the other chemicals in the vapes. What was also interesting and concerning was that there seemed to be an immunosuppressing effect that was recorded with some of these vaping studies. Cinnamaldehyde, mostly used in refill liquids, often cinnamon flavor, impaired the function of immune cells in the lungs. One meta-review testing 277 different vape liquids and chemicals found that this ingredient in 25% of those products. And in mice, 3 separate studies showed that mice who were exposed to this chemical were immunocompromised, and when tested with being injected with influenza, were statistically significantly more likely to get the flu. Now, the implication of this is disputed because a number of studies also pointed to nicotine possessing anti-inflammatory properties, which in some cases makes nicotine an agent to treat ailments such as Crohn's disease. But it also is shown to likely slow antibody-forming cell responses that are very helpful to a person in fighting, for example, a virus. So to try to conclude this neatly, there does seem to be rather conclusive evidence that vaping, especially flavors, can inflame lung cells, exacerbate asthma, and bring on or intensify bronchitis. And while nicotine's effects without the rest of vaping chemicals is less clear and likely more negligible, nicotine with flavoring does seem to carry a risk of lowering immunity in the respiratory system, which in certain mice also made them more susceptible to catching and suffering from influenza. In my personal opinion, the main risks of vaping and using e-cigs, aside from the respiratory and immune system ailments we just talked about, is the variation of the products. The fact that there are so many different chemicals that are found in all different levels, in different flavors, in different brands, and even in different devices with different combustible power. So this gives a person a total lack of control over their e-cig use and what they're putting into their bodies, and confounds research efforts in a way where it makes it harder for us to really understand the effects that vaping can have on the body. So the idea that young people who were otherwise healthy that are now getting very sick from coronavirus may have done so because of past of smoking cigarettes or vaping actually is not very far-fetched based on what the data is telling us. So with this, there are a few tips where someone who depends on nicotine or e-cigarettes can reduce lung damage and their risk to severe coronavirus symptoms or other conditions that can make them more prone to severe symptoms. For the duration of the pandemic, harm and risk can be reduced by not smoking both tobacco cigarettes and vapes or e-cigs at the same time, but choosing one of those nicotine delivery methods and sticking to it. This probably should have been brought up earlier, but e-cigarettes are less dangerous to a person's health, both short or long term, than tobacco ones. That was a resounding conclusion that came up in studies over and over and over again. But regular cigarettes and electronic ones work in different ways with different chemicals and pose different risks. So you are better off using only one of those methods and sticking to that method. That also means that if you do prefer tobacco cigarettes, you might be better off staying away from vapes just until this virus clears up. You're also likely best off using the same brands of e-cigs, the same vape juices, the same devices. Keep everything in your vape and e-cig routines as standardized, consistent, and identical as possible. That way you're reducing the variability of risks that comes with devices that may be more strongly combustible than other ones that you're using, or the vape juices that may have potentially different levels of harmful chemicals, nicotine concentrations, or flavoring chemicals. Remember, no two brands of anything e-cig or vape related are the same. Also, if possible, you could reduce harms by getting rid of certain flavors like Juul's creme brulee or cinnamon specifically that are known to have higher concentrations of lung cell irritating and immunosuppressing chemicals. Thanks for watching, guys. If you have any questions or would like me to post about anything else, my Gmail can be reached at alldrugnews@gmail.com, and you can DM me on Instagram at AllDrugNews. Thanks, guys. See you next time.